damage which is elicited from an objective risk as it was by the COVID-19. So this was my final word. Thank you for listening. Now, normally the slide. Thank you for listening.
Okay. Yeah, many thanks, Julian, for this interesting and enlightening talk. I would like to open the question time right away. So, if anybody has some questions in, as I said, in English, German, Italian, maybe even Portuguese. Okay, Daniela.
So first, thank you very much for your presentation and for telling us all these experiences, also your own experience and this kind of reflexive.
Daniela, we can't hear you really well. There is some interference.
Oh, okay, sorry. So thank you for the presentation. Now my question is, if you met also people who actually reflected on their own fears and on the concept of danger, because I appreciated that you refers to theory of risk, but also to the theory, probably classic theories on danger, and when you refer to certain magic, I mean certain kind of magic reactions of people in their everyday life, reaction to the fear and to the risk of the virus. I mean, I would like to know if someone among your contacts actually tell you about a kind of self-reflection on this magic turn. I mean, you know, among us, a lot of, I don't know, I think that the general perception that we have, or many people have about themselves, is that of a very rational human being. You know, most of us were scholarized. I mean, were socialized in the school. Mainly people have some kind of medical and also scientific notion. So, I mean, what happens when people perceive that they are in a certain way going backward to a kind of magic attitude in their, probably unconsciously, I don't know. Have you?
Okay.
Yeah. Have you?
Okay. Yeah. I want to ask. So your question is if the people that I spoke to, if they perceived their rituals and that I frame as rituals as magic as something like this, right? So if they did it consciously.
Yes, if they reflected on this stage, in their scientific attitude, in their life, in their everyday life, and how this attitude, this kind of scientific rational attitude could change in such a specific risky times, risky days. And thank you.
I think, thank you for the question. I don't think that people do this consciously. And as I mentioned before, this magic is not something that is just in this, emerged just in this COVID-19 crisis. This is something that all of us do every day, somehow in some occasion, but we are not consciously doing it. So this also has to do with the individual risk perception, because as I mentioned, people that experience a high level of risk connected to the COVID virus created this, in my eyes, ritualized habits, including objects and body, to reduce their individual risk perception. This is something, I don't have an example for my own day-to-day life, because maybe I don't recognize it as a magic, but I think I do a lot of this stuff when I'm uncertain or I perceive a lot of risk just to get sure. So I don't think that they did it consciously. If this responds to your question.
Yeah,
maybe someone else has some thoughts.
in this case, what should be or what could be the difference between a kind of ritualizing practice, I mean, a kind of well, domestic medical practice and procedures, and a proper ritual? I mean, it's an interesting overlapping of both in your presentation. Have you thought about this? I mean, what's the possible difference between ritual and a ritualized practice or procedure?
That's interesting. Okay, now I see your point. Like, where is the difference from a medical procedure which is like scientific and a ritual which is like magic? You mean this?
For example, yeah.
I mean, that's an ontological question, right? Because the other is based on science and derives its reasons and things from science, but these magics are just framed as magic if the scientific knowledge or the information people have, it's not congruent with the actions they are performing. So in this case, it was the probability to get infected through a contaminated bag of crisps, to say something, is really low, but even though people were sanitizing it. So I think that's kind of a difference. But I think that magic is also part of medical procedure. Mm-hmm. So I would see it differently. Like, I would put some magic also in medical procedure, which are based on scientific knowledge and on real things. But this would be an interesting analysis, like the rituals that doctors do on basis of scientific knowledge, or maybe not.
Thank you.
Thank you for your question.
Okay, are there some other questions? Tobias?
Thank you very much, Julian, for your presentation. Better? You understand me?
Yeah.
Okay. Just a question or more comment. I read Ulrich Beck some years ago, so perhaps I'm always a bit. I'm also a bit not that in Ulrich Beck to. Perhaps you know it better. As I read him, there is not. He doesn't make a very strong dichotomy between objective risk and social risk, or socialized risk, constructed risk, as you said. For him, what I read out of him, it was like they come together. And also, if we see COVID, this is a very good example that objective risk and this construction of a risk is going hand in hand, because we don't know what is the risk of COVID. Still, we don't really know what it means. We are in this pandemic, and with exposing this scientific data, which also there you could say, are they objective? Are they describing the virus? Should we do an interview with the virus? Would this be a solution? I don't know if the virus will tell us that long. But where is the line between objective risk and constructed risk? And what does this mean? This line between objective and constructed for the structures coming out of it, the social structures or social orderings coming out of it. Is it the same in the end? Is it more like Thomas said, what we think what we think are the are important things will have effects, no matter if they are real or not? Mm-hmm. That was comment question. How do you think on
Yeah.
it.
Yeah, thank you. Yeah, because I used Beck because, as you said, he has these two perspectives, but I like this objective view of risks, which also are linked to things we do. So in that sense, they are kind of objective because they result from certain things we do, and so it's not that they are created, they are there. As he said, the consequences of or climate change, for example. Climate change is, in my eyes, an objective risk, and he also refers to it as a kind of risk which is out there, because it results, it's the consequence of human, or it is enhanced through human actions, and it has an effect, like extinction is a result, people die, nature is changing. So I would define this as somehow an objective risk.
Going to,
but you're yeah, sure. Yeah, but I think nothing is entirely objective and nothing is entirely constructivist. But I think in this crisis, it was important to recognize also for the people in isolation that the COVID-19 is a real risk. This was really important for the whole trajectory, that people complied with the measure, that people wore masks, that people took this thing serious. And they needed to recognize the objective risk. But you're right, if you, for example, compare Italy with another country, for example, Sweden, so this objective risk of COVID-19 is interpreted completely different. So you're right, where is the line then where it begins to be constructivist and where is it just objectivist? But as I said, nothing is just out there, right?
Thank you.
Thank you for your question.
May I?
Visa?
Yeah. Thank you, Julian. Was I mean, very interesting. Of course, I do live in Italy. I do live in Bozen, so I somehow share many of your consideration. Of course, as you said, you arrived from another place, and I guess this was very important for your research. As for any, let's say, ethnographic research. And that, so your what you said was really interesting, because this really was something that I was missing somehow, because I was here and I saw everything little by little, whereas you arrived and you saw everything all of a sudden, the change, no? And so I maybe later I will get back to, I have the same doubts that Tobias has about this subjective constructivist, but I don't want to get to this debate because it's too big. And instead I want to get back to few things that you said about let's say the dynamic of let's say the dynamic of risk and the compliance of people with certain requests and certain regulations and so on and so on. I mean, relating to my own experience and to what I thought during this period, I really think that, I mean, you point to uncertainty, and I really think that uncertainty, as Tobias was saying, we are still quite ignorant about this virus. And so our uncertainty had really a big relevance in all this process. In the sense that, differently from other situations where, I mean, people have more or less knowledge, or they think to have a certain kind of knowledge, here, little by little, we discovered that we were ignorant. And what 1 week you would say, oh, that's exaggerated, because, I mean, at first, people wearing masks, I wore mask very late, and I thought, oh, that's exaggerated, or let's close the university, or that's exaggerated. And then little by little you somehow accept, but not only accept, somehow you think, okay, maybe they are right. I really don't know. I mean, I misassessed, misjudged many things before. So maybe, and so this, I mean, what I experience is that little by little, it's a sort of increasing ignorance that allowed me somehow to, let's say what you said, trusting government. But this trusting government was also led by somehow uncertainty and ignorance, because somehow also the government, especially the Italian government, but it's not just the Italian government, I guess any government, I mean, no government has been able to act in a straight way, and so on and so on. And somehow there was also this sharing of ignorance with governments. So, I mean, maybe they would not express it like that. I know that in Germany, somehow Angela Merkel somehow did express a sort of, look, we don't know much about it. And so there was an official expression of ignorance and uncertainty. In other cases, there was probably not such expression, but certainly we could see that also these people, these experts, were somehow, I mean, in the fog for many things, and were clearly discussing and having different opinions. And so on one end, there was this, okay, we all share this ignorance also with the government. And somehow there was this solidarity for me also with in my case, with the Prime Minister, which I would never think of. But somehow, okay, he's trying to do what I mean, and so there was this commonality, which was based really on understanding that we don't know, and so that means that also we have to use the most extreme measures, because we don't know. I mean, in extreme ignorance, you accept that, okay, the highest measure are what we can we really don't know. So so I think this link, and so I don't add much to what you said. Just, I mean, confirming that this thing of uncertainty and ignorance was important. What maybe I had to what you were saying is that this feeling of togetherness and identity that then can also become nationalism and so on was really grounded on a shared feeling of ignorance. Sometimes I express explicitly, sometimes implicitly. And I think this was somehow very interesting and very somehow also educational in a way. I mean, very, very for everybody, I guess. So thank you.
Thank you.
Okay, thank you, Elvise. Roberta? Roberta?
I had something. Do you hear me?
Yeah. Yes.
Okay. For your talk, you gave us a lot of insight related to what. Can you?
Not very well. You are. It's like in pieces. We can hear you in pieces. Maybe
here?
If you switch off your camera for a second, we can hear you better.
Can you hear me?
Not well.
Okay. So, better?
Yeah. Better, yes.
Do you hear me?
Yes.
Yeah.
So, I was saying that, wait, I have to go to the balcony, otherwise there are too many kids here. That I wanted to, no, good idea. I wanted to relate to the comment made by Elvise that I really like this expression of sharing the ignorance with the state, and made me remember the concept of cultural intimacy of Herzfeld somehow. because really this is as well what I experienced, this intimacy with you Alvise referred to solidarity, but also really this intimacy because we were going there to the root of survival. So it was something very intimate. So Alvise, I thank you for this concept that you gave us, thinking through Julian presentation. And related to your presentation, Julian, I think from what you said, this reflection about risk is also quite clear that risk is a concept that is very important, especially for the first part of the crisis, to avoid increasing contagions. But then somehow is also a very limited concept to think through a pandemic, because what we are witnessing is a phenomenon that is not just human, and risk goes back to a very individual conception. But the risk, the aspects posed by this pandemic are more than human, because as you said, it's this cosmopolitical situation. So I was wondering, and this is a question I have for you, but also open to everybody else, if you have any alternative to think through how to handle the risky aspects of the pandemic without going back to the concept of risk. This is the first question. And the second one, again, open to everybody in case, is I'm thinking those, you spoke about the importance of the mask, Trump reaction to mask, and all the resistance of wearing the mask of his party and all the fans of Trump. So I don't know if you have seen some video of these radicals that really express their deep resistance against that. And I'm thinking that this is quite paradoxical for a party as that of Trump, or a person as Trump, that wants to build walls everywhere, wants to protect America first, wants to make a wall against Mexico, and so on. So means of protections are, as a mask or as a wall, they change according to a context. So I don't know if any of you has made any reflection of these and how to make sense of this refusal of confinement and protection in the Trump government vis-a-vis his very protective politics. So thank you.
Thank you for the questions. Maybe I can try to say something for the first question you mentioned. If there is another concept through which this crisis can be observed or constructed, and now I come back again to this objective view of risks, or not the objective view, but more the risk society of Beck. So this crisis, as we experience, might just have been possible because we are in a risk society. So if we would not be in a risk society, as argued by Beck and others, the risk would not be as evident as it is. I mean, there are many others, authors which write about the risk. Foucault is another really important one who speaks about the risk in modernization processes, and where risks intruded in all different aspects, from public health to neoliberal politics. Everywhere is this risk. So I think this is more a mirror which shows the conditions or the circumstances which makes or construct our society right now. I don't know if maybe someone else has a thought about that, about the first question.
I was my question prompted also from a lecture I heard about a virologist, and he was saying that from a virus perspective, there is no risk, because we have about between 0.1 and 1% of mortality, while in the natural world, the rate of extinction is about 20% in every species. So from that perspective, is not really risk. So risk is very much a human-centered perspective. Yeah, but thank you from your answer anyway.
Thank you for your question. And for the second one, I with the masks, like this is really difficult question, and I myself experience this, maybe someone of you too, this wearing the masks. Yeah, as Alvise mentioned before, I mean, it's just a mask actually, but it was really difficult to wear this mask. I don't know why. Even though it's just a mask, and probably it saves one life if you put a mask, but even though people have kind of a resistance, I don't know, I have not really an idea where this comes from. And in the US, maybe it's especially with this narrative of being against the establishment and being against the mass media and the other side of the perspective to the world, maybe.
Yes, it's good. It's a good answer. This of being against the establishment.
Yeah, kind of obstinate behavior, like as they have in many other issues as well, like the Trump people. I think.
Perhaps I also can share some thoughts on this with the mask, and the resistance to wear a mask is also, I think, connected to our behavior and our normal style to present us to each other, which is not covering the face. I mean, being open to the other, so you can read the face of the other. That's also a cultural thing. I mean, in Germany there's a Vermummungsverbot, for example. That's something which is inscribed in our laws in Europe. In our cultures, not. Also in France, I remember that a friend of mine, French friend, of which I have few, but some I have. They were. She was at school. She was wearing this scarf from Palestine, which were very in trend in also in my days when I've been in school, and she put it also on her face, and she was repeatedly said by the teacher, "Don't put it in your face, you know, we have by law it is forbidden." So people are very they will tell you your false behavior, and that's also something which you are expected to be more or less open-faced among us.
I see.
Yeah, can I?
Yes, please.
Hi, I'm here from the University of Zurich, so I'm in Switzerland, and I'm an anthropologist, and I do my work in Japan. So because here in Switzerland, people also had a very hard time in wearing in public a mask. And then there were protests in Bern and in St. Gallen saying like they don't, and this also not only refers to wearing masks, but also to the lockdown in general, that they want freedom and no coercion, they said. Now actually in the news, it just says that there might be a request here in Switzerland coming through that people wear masks in public transportation. but they really had a difficult time in accepting that. And when I wore a mask to do my grocery shopping here in Switzerland, people would scurry away from me, which would actually, because they thought I'm a carrier of the disease. And but it had the right intention for me, because they would be staying away from me, but they would really scurry away in the very beginning when the pandemic was just sweeping through Switzerland here. And I think in comparison to Japan, I mean, they have the practice, and not only in Japan, but in other Asian countries, they have the practice to wear masks, and they're germaphobes. They don't give hand or shake hands. They don't embrace when they greet each other, but they bow. So there are social practices in place that would not transmit the virus so readily. I mean, here in maybe in Italy or in Spain, people, or where I grew up in Brazil, people hug and kiss when they meet, and then surely it spreads much faster. But in Asian countries, not only did they have the experience with SARS, where they knew the protocol of how to protect themselves and personal hygiene and wearing masks. But for us here, I think it was the first time. And if we were to be hit by another pandemic, and this might actually occur, not only the second wave of this one, but from another virus, because not only we have anthropogenic climate change and overpopulation, which causes the virosphere and the anthroposphere to have friction zones, and it brings forth these pandemics more frequently, and not only at the rate of 10 to 40 years, but it might occur more frequently. So my point being, if another pandemic comes to hit us here in European countries, we might have learned from this experience of how to protect ourselves, and by wearing the masks. I think it was just something so new for people, and it was really hard for them to accept, whereas in Asia they immediately would wear those masks in public, and also in public transportations. Yeah.
Thank you. It is a good point that came into my mind too. Also the difference between an individualistic society and a more collective society. So my experience when I have been to Asia was that people were wearing masks when they were coughing, and when you ask these people why are you wearing the mask, they say, yeah, because I don't want to transmit the virus to someone else. So there was already this collective kind of thinking. Whereas here in Europe, maybe this mask is like, why should I wear a mask? This is like a break of my liberty, of my individualistic liberty. Why should I, reduce my liberty for someone else? And in China also, the mask was introduced in China in the bubonic pest, you call this in English, pest? The last one in the beginning of the 20th century. So also there it's like kind of a recent thing. And the mask was interesting also during the Spanish flu, because there the mask also emerged in the US and in other countries. And it's also interesting how the mask was used there, because in the US the different states had differing policies for the Spanish flu. So some regions, for example, implemented isolation measures and others didn't, and some did the mask and others not, similar to now. And the mask there was also perceived as giving you the sense of control. And so the regions who had masks reopened everything, and then had a higher mortality of other regions which didn't have masks. So this is also an interesting point. But the point that you made, so like in the US, they used, or in the Spanish flu, also in the West or in European countries, they used masks. So the question would be why it was maintained in Asia or in China or in Japan, as you referred, and here in Europe not.
Okay. Somebody else? Alvise?
Yeah, I have an actual question, which is really something that I don't know, but I was wondering, and maybe Julian, but somehow also Roberta, in a way for our future research, can tell me, or maybe other people. I'm referring to the issue of risk society and to the relevance that in our societies, and especially in certain societies where the healthcare system is private or semi-private, of the relevance of insurance companies. Because clearly insurance companies, in my opinion, determine quite a lot what is risk or not, or what is not risky in a way. And I have been always wondering all through the crisis if a certain resistance of countries like the Netherlands to somehow declare and to take measure was related also to insurance, in the sense that if you declare that there is a crisis, somehow, probably, I don't know, it's really a question, insurance needs to pay for certain cure and for, if you do not declare that is a crisis, so for instance, if you have a flu or a cough and it's not declared, you just have a cough and maybe you call your insurance company and the insurance company says, okay, it's just a cough, we don't cover that. But clearly, if you declare that a cough can be something major, the insurance company has to somehow manage this thing. And so I was wondering if any one of you know, because I didn't read anything actually on this, what role insurance companies played in all these crises. And again, it's really related to the issue of risk. So this is really an open question, but maybe Julian, you have some clues and some hints. Thank you.
Yeah, thank you for the question. I don't know enough about insurance in the healthcare system of different countries, but in the beginning, when I was still in the Netherlands, I do perceive that. I mean, you could frame this with the privatized understand this through the privatized healthcare system, but they were quite not testing a lot at that moment. Where in Italy, where we have the statal healthcare system, they were testing much more. So yeah, this could be linked to increased costs. And sure, the insurance companies are also part of this risk society. And just an interesting fact, because a friend of mine works in an insurance company, and I asked him if there is an insurance for a pandemic. And actually there is. And the London tennis game, I don't know what's the name, this really big one, was insured for a pandemic, and they received now money because the pandemic emerged.
Thank you.
I have.
Lisa, thank you. Really interesting question, and this is an important aspect. I didn't read anything about that too, only with the exception of the fact that these aspects influences the communication of WHO of a pandemic. Because in the past, for SARS in 2003, WHO was accused to have communicated the pandemic too early, because and this was detrimental for insurances and many other actors, economic actors, and this time they were almost accused to declare it too late, but because they paid the price before they declared a pandemic, and then was not or maybe it was in the case of NH1, the influenza, but anyway, something in the past. So of course there are these politics of insurance creating this objective risk or whatever, and it's something that should be explored more in depth.
Thank you, Roberta.
I have a quite specific question for what concerns South-Tyrol, where you did your ethnography. That I was living a kind of diversified perception of risk in this case, and kind of, yeah, I don't know. It seemed to me that it was kind of related to also diversified media consumption, mass media consumption. That there was kind of a trend that Italian-speaking friends of mine.
We lost you.
Stefan?
We lost you.
We lost you.
Hello?
Yeah, okay.
Okay, where did you lose me?
The different media consumption.
Okay, yes. No, because I experienced that mainly it, yeah, I mean, how to say, a different like perception of risk and I mean, Italian-speaking friends, they started to wear masks earlier and to take even these severe isolation things like measures for good, and while German speakers relating maybe more to German media or to Austrian media, I don't know, they had kind of more easygoing attitudes towards the virus, and they did not approve as much as the others, like these strong measures, which even caused some conflicts in my opinion, because like I saw some guys, some kids playing football down here, you know, and then police coming and somebody called police, you know, so it's so did you see such a trend while you were doing your ethnography, or?
Okay, thank you for the questions. Yes, I do, but it was really difficult, or I had difficulties to frame it, because I think just the language is too simple, because there are so many other aspects which influenced. But indeed, as you mentioned, it makes a difference if you see the whole time the situation in Bergamo and these cities, or you watch the German news where people are outside the whole time and saying like, yeah, the crisis is here, but it's not such a big deal. So I think this has an influence, but also all the circumstances that people are living. So I, for example, perceived a difference in countryside and city, obviously. As I mentioned, this person said she doesn't perceive the crisis over there because she can't see it. So I think there are many factors which created this difference of perception, and media and the media consumption is one really decisive one, because the risk needs to be mediatized. So the information that I received through the media also constructs my risk perception. So obviously it is important which media people consume, and this difference I also perceived. But I think important is also because the reality was different, right? So because people, some informants told they consume media, but not TG, Cinque or whatever. They just in the internet. So, but in the internet still, it had media from Italy. So it depends on the country you focus, right?
Yes, because I mean, for myself, I was always kind in the middle, you know, because looking at Italian and German media, and so it was like, okay, it is dangerous. Okay, no, it's not so dangerous, and I think many other people maybe experience that as well. Do we have more questions? Otherwise, I think it's 7:30 now. We could even come maybe to an end. Okay. So Julian, thanks again.
Thank you for the invitation.
Thank you. Thank you all for joining us. And I just want to remind you that on July 7th, we have our second webinar on COVID-19 and anthropology, which will be moderated by Roberta. and we will have Professor Eben Kirksey from the Deakin University of Australia.
Yeah.
Okay, from the Deakin University of Australia, and he will talk to us about the multi-species perspective on COVID-19. So he will take the perception of the virus, if I got it right. And yes, so it would be nice if you join us again.
Thank you very much.
Good evening.
Thank you.
Thank you.
Thank
Ciao.
you.
And
Bye.
greetings,
Ciao,
Christine.
ciao.
Bye.
Bye.
Thank you.
Bye.
Bye.
Bye.